Hello, my name is Milena Santana. I'm 22 years old. I've been graduated as a veterinary for 5 months, and it's my beauty for caep. First, I'm brushing and cleaning because it'll be assembled. I used two types of brush. One was harsh and the other one was soft. Then I'm saddling the horse and placing protection on his joints. You'll see it's too important because, as I said, he'll be assembled. So he'll run and he could have some injuries in his limbs. I did it in his forelimbs, and then another horse helps me. So I started the physical checkup by looking his ocular mucosa, its color, and his third eye. I continued checking if he had abnormalities in her ear pavilion, and I looked his oral mucosa too, because it's important for checking his color and the capillary filling time. It's important also check if there are ectoparasites, because, for example, here there are a lot of horses, so it's easier to get in contact with them. Okay, then I began to check if he has something abnormal in his muscles or some discomfort in his limbs. Of course, the first one. Then I used a stethoscope for checking his heartbeats in his side of the horse. I checked mitral, aortic, and pulmonary valves. I did it for a minute, and then I took his frequency because I wanted to know if it was between range, and it was. And also to hear the three valves that I just mentioned. Okay, lung auscultation is a crucial part of horse's physical examination. So I heard lung sounds, and I also took his breathing rate for a minute too. It's important because it allows us to determine the health of the respiratory system and to determine if the horse has any disease. In horses, checking their digestive system is too important because of frequency of digestive diseases. So I used the stethoscope to hear it and determine if there were sounds abnormal, and luckily they were easy to listen because the horse had eaten just 1 hour ago. I did it for a minute and I continued checking his limbs as you are seeing. I checked if he had pain on her muscles or swelling or something that could determine if he has some problem in his limbs. Then I'm preparing the thermometer to check his temperature. I always stand sideways to the horse to be safe, and the horse is safer too. It's important to do it because it helps to detect diseases early. Okay, then I began to check him by the other side. So I began checking his ocular mucosa, its color, his third eye light, also his ear pavilion, if he has swelling or something like that. Then I checked his limb. He had no pain, no swelling, and so I continue. Okay, then I'm checking his pulse to determine if it matches to his heart rate and to know if it's strong enough. Then I'm hearing the heart again because I want to hear the tricuspid valve if it doesn't have any irregular sound. Here it's not important to determine again his heart rate. And then I'm checking his lungs, also just the sounds because I already take his rate, yeah. I'm checking his last limb if it has pain or it's swelling because it's important to determine if the horse has claudication problems and to perform more tests if it's necessary. But it isn't necessary. Okay, then there are some photos of me working at Rancho Zeta, doing pre-surgical anesthesia and surgical assistance, and yeah, that little thing. Then I had the opportunity to do my externship at Brandon Equine Medical Center on Brandon, Florida, and there are me performing X-rays with two technicians and with Dr. Mike Marr, who is specialist on sport medicine. I had the opportunity to understand how the limbs works, how should they look, and how should you treat them if they are any injury. So okay, yeah, there you can see that I'm helping doing the X-rays, and yep. Okay, it was my favorite part of the externship. I was doing dentals, and then I'm helping on a orchectomy. It was performed by Dr. Mike Marr too. There I was doing my gastroscopy. There was helping with some surgeries, and then it's me with a patient.